Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for a radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also, just joining us are our friends at our Heart Radio and Amazon Music Podcast. We're glad you all could be with us as well. This is part of our News You Can Use segment, and today we're talking about enlarged prostate, or BPH. It's a common condition as men age. It affects half of men in their 50s and about 90% of men age 80 plus. Well, what do you all need to know about BPH, as well as an exciting new treatment option for it? We have the perfect guest here to talk to us about it. I'm excited to welcome Urologist Dr. Krambeck to our program. She's going to share with you guys some great information that all of us can benefit from. Dr. Krambeck, thank you so much for the time. Really appreciate it.
Well, thank you for having me today and giving me the opportunity to discuss something that I'm very passionate about.
Well, I will be 47 this year, Dr. Krambeck, so I'm definitely, you have my full attention, and I know for our audience out there, this is something all of them can benefit from. I mentioned enlarged prostate is called BPH, but what exactly is that, and what are the signs and symptoms our audience should be aware of?
So BPH stands for benign prostatic hyperplasia, and it's just a natural enlargement of the prostate as you age. So much like your nose and your ears that get bigger every year of your life, your prostate does too. And when we urinate naturally, or men urinate naturally, they urinate through the center of the prostate. So as that prostate enlarges, it starts to kink down on that urinary tube or the urethra and making it more and more difficult to urinate. So that can present in two types of symptoms. Either the stream is getting really slow, you're having to push or strain to urinate, can't empty, or you might have more irritative symptoms, like I got to go right now, I'm going every hour, I'm getting up multiple times at night. So both of those types of symptoms can happen as the prostate enlarges.
So with that being said, and knowing that it really does impact, all of us guys at some point or another, right? What are some of the latest advancements in treatment options for men with BPH now?
So most men with BPH, the first step is you need to go see your physician, right? A lot of men will hold on to these symptoms, not discuss it, not go to the physician. And then once they go to the physician, they'll probably get referred to a urologist. They'll discuss possible medication versus office-based procedures versus surgical procedures. I specialize in a very unique surgical procedure called HOLEP, and we use a holmium laser to enucleate out the inside of the prostate, hence the name HOLEP. And it cores out the inside of the prostate. Your downtime is about a week, and you should never need another surgery for your prostate again. It's kind of a one-and-done deal. So patients really like this procedure. It's maximal relief of their symptoms, and it kind of resets the clock back to their 20s and 30s when it was not difficult to urinate.
Wow. This is great information. Dr. Krambeck, I'm so glad we have you on, as now more people are getting caught up on those doctor visits, maybe that they may have put off, unfortunately, for the past couple of years because of the pandemic. Is that also part of the encouragement you have for our audience to make sure that they're doing that, one, that they're seeing their doctor, but also, two, having these type of conversations with their doctor?
Yes. So I think a lot of I see it more with men. They just don't want to complain or discuss the problems or symptoms that they're having. And sometimes they leave it to the doctor to figure it out on their own. So they think, well, the doctor did a blood test, they did a rectal exam, they checked me for prostate cancer, I must be fine. But it doesn't tell us what kind of symptoms you're living with every day. So you really need to share that. You need to say, I'm getting up 4 to 5 times per night. I'm having a hard time urinating, because that will initiate further workup and treatment. Because this isn't normal, and you don't have to live with it.
So this is great information, again, for all of us, but especially for those who may be dealing right now with enlarged prostate or BPH, knowing that there is a treatment option out there. This is not something that you have to just live with. Again, everyone, our guest has been urologist Dr. Krambeck, sharing some valuable information with us. Dr. Krambeck, where can our audience go for more information?
2 websites. The first would be the Northwestern website at www.nm.org/urology, or my personal website, which is www.drkrambeck.com.
All right. Well, thank you so much again for the great work that you're doing and for the information for our audience today, and I hope you'll come back on the program again.
Well, thank you so much for having me. You have a good day.
You as well. And we thank you, our audience, for tuning in to this segment of Conversations Live, part of our News You Can Use segment. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.